I'd like to open up the floor now to committee members. I'll specifically look with Chairman first. For questions, Chairman Leonard.
Thank you, Mr. Chairman. You know, I want to thank both of you for being here. There's certainly been a lot that's been said and written over the last couple of months about this particular topic. And you know, the interesting thing is, I think if you ask the people in this room, do we agree with both of you? I think we'd all say, yeah, we probably do. That we agree with Treasurer Falwell on a number of his priorities, topics, and we agree with the provider community on a number of yours. I do want to particularly appreciate the work that Treasurer Falwell is doing. This is not an easy issue to resolve. It's not an issue that's just come up in the last year or 2 years. It's been around for a long time, and I call it cost shifting. You know, we all pay in healthcare a little bit of the cost for those who can't pay or don't pay, and that cost is spread and shared with us. And you know, pricing is a difficult thing in healthcare. We can all share the price of a lab test or a price of an x-ray. But if you look around the room, we're all different. And if we go to the doctor and we end up in a hospital for a replacement of a knee or some other procedure, the price of that is going to vary because we all look different and we vary. It's hard to tell what a single price is for a single service. But the unit prices are available. They're easy to determine, but the utilization has an impact on what it costs for that service. And I actually believe utilization is a major part of this challenge here. I do want to correct one thing that Treasurer Falwell has told around the state, and that is that Chairman Murphy called a meeting before in last session to talk about this problem. Well, I actually called that because I am very concerned about this issue, and I believe we need to solve this, and we can solve this. When Senator Heiss and I sat down several years ago and started talking about Medicaid reform, and Medicaid is close to a $15 billion program with almost 2 million people, the first thing we did was to listen. We went around and listened to people. Tell us what is wrong with the current system and tell us what we can do. The word that was used by, I think, both sides was, we partnered with a lot of folks to listen to come up with a solution. And we didn't come up with a solution overnight. It took us a long time to listen and come up with a solution. And I think the good news is we came up with a reasonably good solution for North Carolina by partnering with a lot of different providers. We have to solve this problem. You know, we got great doctors, we got great hospitals, great providers. That's one thing North Carolina ought to be really proud of. But the economics of healthcare in this state is a mess. It's ridiculous, quite frankly. And we've got to figure out how to fix it and work on that. I believe we can solve this by partnering the different groups and working on this issue. And I think that's what we need to look at. Specifically, the question I've got for Treasurer Falwell is, if you go down this path, number one, what's the time frame? And number two, if your provider community is not with you and decide not to take care of the participants, and I want to know how many actually signed contracts and agreements to participate in this plan. They don't have to take Medicare, they don't have to take Medicaid, and they don't have to take state workers. What happens if they decide not to participate in your plan? And are you going to have an adequate network? So that's my first question.
Thank you, Mr. Chairman. Obviously, we would hope that of the 61,000 providers that are currently providing health care to the state health plan and active and retired employees, that we would hope that they would accept reference-based pricing that pays them on average 77% above Medicare reimbursement rates and nearly twice as much as the reimbursement rates that they've already agreed to for workers' comp claims and also services that are provided to prisoners who need medical attention. Yet some of these providers will get 200% of Medicare reimbursement rates. We are giving more money to primary care physicians, many of whom who are represented in this room today but will not have an opportunity to speak. We're giving pay increases to mental health specialists who have been starving and who have had to run to the arms of some of these big conglomerates. And we're giving pay increases to many rural hospitals. We're continuing to tweak the rural hospital formula. But I think that you're going to be really excited about what we come up with as far as rural health care. I will say that if you look at the statutory responsibilities and the constitutional responsibilities of the state treasurer in North Carolina, no matter who that happens to be, there's no elected official in North Carolina who has more heart, soul, and mind into making sure that we have access to affordable health care in rural North Carolina than the state treasurer. Because in addition to all the other responsibilities, the state treasurer is the chair of the local government commission. The local government commission issues debt, not only debt to counties and cities, but water and sewer districts and to healthcare providers across the state. I have a unique constitutional and statutory responsibility to make sure that we have access to affordable health care in North Carolina. In terms of what we have said about this issue, all we've said is increase transparency, lower cost, and push the power out. Now, what other people have said, we've said we can't control that. We attack problems. We don't attack people. And there are a lot of people in this room right now who are ready to sign our contract, Chairman Lambert. But in some respects, and I don't mean this inelegantly, they're kind of scared of the hospital association. Some of whom may be members of the hospital association. They're scared because they don't know what will happen to them if they sign a contract for the state health plan. We're pushing the power down to people, and most of the input that we've gotten regarding this plan has come from the very people that Dr. Waldron just mentioned who work in these facilities. They know what's going on. They know that this is not what they signed up for, and they know that we're trying to lead our way out of this situation.
Thank you, Mr. Treasurer.
Quick follow-up. Second quick part of that question is time frame. What's the downside of slowing this down, getting the two sides together, and trying to come up with an alternative? I have indicated on many occasions that the way to solve the healthcare dilemma in North Carolina is through a risk-based capitated model and managing the utilization. There are other solutions to help this challenge. What's the time frame that you've got, and what's the challenge if we were to slow this down, get the folks together talking, and figure out a way to solve the problem?
Let me just interject here. I'm going to allow responses for just 2 minutes only in the sake of time.
Okay. Thank you. Our time frame is to get people under contract by June 30th of this year and to implement it on 1/1 of 2020. That is the time frame. The reason is that there's nothing complicated about reference-based pricing. It's a model that's been built for 30 years. The fact that people do not want to agree that the state health plan is not a governmental purchaser of health care, which it is. They don't want to agree that we've been cross-subsidizing other lines of business, which we have. And then even more nauseating about the comment about, they're just going to do more testing on people. I mean, these are the issues that we're facing. And the General Assembly only funds us at a 4% increase. Our cost of our health care on our state employees and pharmaceutical are going up 6 and 9%. I went to a great elite university called UNC Greensboro, and they taught me that no combination of the numbers 6 and 9 will ever get you to 4.
Thank you. Representative White.
Treasurer Falwell, thank you so much for being here. Appreciate your comments. I share your concerns, of course, about rising healthcare costs, and I guess my concern as a nurse and visiting around the state for the last year and a half in this particular role that I sit in, I've seen the story of the rural hospitals closing. I've seen what's going on. I've heard that. I have seen a reduction of primary care physicians by 26% in the last 2 years. And I know that as a public health nurse, as a home health nurse, a home care nurse, I have seen my Medicare clients not be able to get a physician to cover them accepting the Medicare rate. So I guess my concern is, I think all of our concerns are the rising cost of healthcare. It is exorbitant, it's ridiculous in my opinion. But what can we do to make sure that in rural North Carolina, east or west, that when there are not enough primary care providers already, when we are losing them by large percentages each year, for many reasons, most not related to specifically healthcare. But we can't, again, as Representative Lambert said, we can't force people to stay in the rural communities of our state. But they are leaving. Current Medicare clients are finding it very difficult to find physicians who will accept their payment rate. So if we are, and I'm not using this word inappropriately, and I don't mean it to be ugly, but if we are dumping another 750,000 potential state health plan recipients, beneficiaries at a Medicare rate, who is going to provide this service? I've lived this, I've seen it, and now as a policymaker, a legislator, I see it even from a different perspective. So, first of all, thank you again for all that you have done for North Carolina in many roles that you've had. Thank you for being with us today.
Mr. Treasurer, please respond.
Thank you. Thank you for the question. I will tell you that the closing of hospitals in rural North Carolina has been going on long before I became the treasurer of North Carolina. And Nelson Dollar, when my last conversation with him last year, he called me a poll star. Now, when you're an accountant, somebody calls you a poll star, you probably should look up what that means. What that means is it's something at the top of a flagpole or the top of a lighthouse that does not move and you can always count on it. And the fact is that the struggles of what's happening in rural North Carolina is something that we're sinking our teeth into. We know of these issues. But to correct one thing, this is not Medicare reimbursement rates. This is Medicare reimbursement rates plus 77% on average. Many of these doctors that you're referring to are going to get pay increases under this plan. And as far as going back to, you asked for reference, Representative Chairman Lambert there for just a moment. You know, Chairman Lambert, the people who choose to be on the network for the state health plan are the providers, not us. We can't make anybody come in network. So if somebody doesn't come in network and does not sign our contract, it's because they have chosen not to do so.
Thank you. Representative Dobson.
Thank you, Mr. Chairman. I was going to ask a few questions. I found myself kind of in the middle of this discussion over the last several months, so I'm just going to make a few comments and then turn it over to questions from members of the committee. This has been a tough issue for everybody. This is a hard problem that has to be solved, and rarely does hard problems have simplistic solutions. I understand that by 2023, if we don't do something, the state health plan will be going in the red. I understand that our current path is unsustainable. Nobody debates that. I believe in transparency. I believe we should be as transparent as possible, but we still have to pay the bills. In addition, in my view, that is a completely separate problem from the cuts to providers that are currently being discussed. Basically, what we're doing, and there's been a conversation, a lot of things, but basically what we are doing is asking our providers to do the same work and provide the same high level of care for 15% less than what they are currently receiving. And members, when you come from where I come from, we don't have that kind of margin for error. It is not a stretch to say that providers will close because of these reductions. Second, I know the struggles that state employees face. I know pretty much all of them in my district, and I served with them back in the day. High stress, long hours for average pay. I know the fears when they think about having their retirement going from a defined benefit to a defined contribution. I will continue to fight against this. I know the fears that they have when they see proposals that will privatize many duties that are in fact the role of government. I will fight against that type of privatization. My fear with this proposal is, however, that the very hardworking state employees that I know by name we're trying to protect will be harmed the most. What I mean by that is this. Many providers will not sign this 15% reduction contract, so they will no longer take state employee insurance. As a result, state employees will have to drive further and pay more for the same level of care, and that's unacceptable to me. Yes, I do worry about the catastrophic consequences to hospitals. I'm not talking about the big systems in the urban areas and talking points about high salaries. I can't speak for them. I don't come from that area. But I can speak for Valdez Hospital in Burke County, which will lose $7 million. Or Appalachian Regional, not exactly a big conglomerate, which will lose $3 million. Or McDowell Hospital, which will lose $600,000. We don't have that margin for error when you come from where I come from. Those hospitals are not just places to get care. They're part of the community and something we can be proud of. And we can't afford to lose that. So I hope we can have a comprehensive strategy. I hope we can work together and find common ground that does not have unintended consequences that this has the potential to have. Thank you, Mr. Chairman.
Thank you, Representative Thompson. Just for planning purpose, ladies and gentlemen, this is such an important topic that we're in this room until 12 o'clock if we need to. So just to make that so everybody understands what the schedule will be. Next on the